My name is Nicole Macias, and I'm going to talk about home use of an artificial beta cell in type 1 diabetes. So, home use of an artificial beta cell 1 type diabetes. Artificial beta cell or closed-loop insulin delivery system expands on the concept of a sensor-responsive insulin delivery. The closed-loop system differs from conventional pump therapy and therefore suspended approaches in that it uses a control algorithm that autonomously and continuously increases and decreases the subcutaneous delivery of insulin on the basis of real-time sensor glucose levels. Some investigations have shown improved glucose control and reduced risk of hypoglycemia. So, applications in medicine. The artificial beta cells use a control algorithm to independently monitor and increase or decrease insulin delivery based on real-time sensoring of glucose levels. In contrast, insulin pumps that link insulin delivery to sensors that continuously monitor glucose levels can only temporarily expand insulin delivery based on present glucose threshold. The symptoms can decrease the risk of hypoglycemia but cannot respond to hyperglycemia. More consistent glucose values were observed with a closed-loop system than with a controlled therapy, despite high day-to-day variability in insulin requirements. So now we have the pros and the cons. The advantage of closed-loop system is a responsive graduated modulation of insulin delivery, both below and above the present pump regimen, which allows for improvements in the proportion of time spent in target glucose range and lowering of the mean glucose level without increasing the risk of hypoglycemia. It would be very useful for patients while they sleep or play sports and proves useful for home use. The cons. 3 severe episodes of hypoglycemia happened with the artificial beta cell, all when the system was not in use because of low battery or the system was not turned on. Artificial beta cell technology is still fairly new and feasibility, safe, and efficiency of its prolonged use in the home setting have not been well established. So here we have another video. So the issue applied in Ecuador. Diabetes is an increasingly common disease in Ecuador. There are 2 types, 1 and 2. Type 1 affects more children and young people. Type 2, it's more common in the country and affects mostly adults. Of 100 diabetics in Ecuador, 2% are type 1 and type 2 is 98%. The type 1 is prediabetes, which is reversible and controllable but not detected and treated in time, becomes irreversible diabetes. If the blood glucose exceeds 126, it's confirmed diabetes, which is treated with oral medication and insulin. Most used in treatment of type 1 diabetes is insulin. Insulin pumps are also used in our country, but a lower percentage because their implementation and maintenance is economically high. So the issue applied in Ecuador. Lantus is usually given a slow-acting insulin which lasts about 24 hours. At the time to eat breakfast, lunch, and a snack, you will need to manage a fast-acting insulin called Humalog. This insulin is given to the patient before a very big meal to not shoot in high sugar levels. They minimum must use test strips 3 times to know the level of glucose in the patients.